Good morning, everyone, and welcome to the Ask the Expert series on LearnTV. I'm Lanisha Vaz, and I'm very excited today to be taking you on a journey to talk about the world of healthcare data, and in specific, things around data interoperability and the Azure API for FHIR. Today, I'm joined by Doug Seven, Senior Director of Microsoft Health Next. Welcome, Doug.
Well, hello. How are you this morning?
I'm doing good. How are you?
I'm great. I'm excited to talk about healthcare.
Yes, very excited. I'm sure our listeners are also going to be super excited to learn everything that you're going to have to share. So we're talking about fast healthcare interoperability resources in the world of healthcare. So I thought an appropriate question to start with is, what really is this? It's called FHIR. So what is FHIR, and why should healthcare developers really care about it?
Sure. Great starting question, because I think a lot of people have heard of FHIR. We're still finding lots of people who aren't aware of it. So the thing to know about FHIR, again, it's an abbreviation or an acronym for Healthcare Interoperability Resources, FHIR. So the first thing you have to know is how to pronounce it.
Yeah.
FHIR. But what FHIR is really just a specification for the exchange of data in systems. And so much like something like a Bluetooth or a USB, it's simply a specification that was defined by a working group made up of different representatives from across the healthcare space, payers, providers, software vendors, to define a way to consistently and reliably exchange information from one system to another. So if I have patient data and I want to send patient data to you, the most important thing is that we understand each other when we share that data back and forth. It doesn't really matter what you do with that data inside your system, and it doesn't matter what I do with that data inside my system, as long as we've agreed on the exchange of that data. And so the FHIR specification defines somewhere north of about 120 different what they call resources. And you can think of resources as objects or entities. So patient is a resource, observation is a resource, medication is a resource. It ends up being a little bit like a graph type system. A patient is related to an observation, but so is a practitioner related to that observation. And you can find a relationship between these things through the graph of this. So the challenge really is just understanding what the specification is and then building the inputs and outputs to support that. And so the FHIR specification defines the resources and the shape of the data. And it also defines the APIs for exchanging that data. What are the ins and outs? How do I create a new patient in my system? How do I update a patient? How do I delete a patient? And then these just become documents that you manage and store within your system. So that's kind of the quick flyover of what FHIR is and what's important.
Is this sort of, I think you said that, it's about how you exchange information about a patient. So is this, if I was to take my example, is this like when I go from one doctor to another and they usually ask me for my records or things like that, and I have to go and make a request, and then even within a system, a hospital, sometimes I have to give my information. Is this something to do with that?
That's part of it for sure. It's definitely like that's one of the painful parts of the healthcare system today, and especially here in the United States. I often share a story that a little over a year ago, my son had appendicitis, and we diagnosed it at one practitioner, and then we had to go to another place to have a surgery done. And as we were transferred from one hospital to another, they handed us a manila envelope with printouts of all the observations that they had made while we were there in the diagnosis, because that was sort of the state of the art for transferring data.
Yes.
Now, certainly there's other ways to do it, sure. But the ideal way would be that they could just send that data over to the other hospital or give it to me in a way that I could take it with me to that hospital. So FHIR is really designed to solve those problems in a system way. Like, how does one system talk to another system? But it also, like, if you have an iPhone, Apple has embraced the FHIR standard like other companies have. And so the health app in the iPhone enables you to connect to your provider and download your medical information from that provider. And it's downloaded in FHIR format. And there's actually an option at the bottom if you're looking at, say, let's say you went to a checkup and they took your blood pressure, and you can see that that data on your phone. If you scroll down, you can see a link to the actual FHIR data. So you can see the JSON FHIR document that shows you what all that data is. And so this is important because it means that systems, one hospital can share information with another hospital, or even more interestingly, a health plan, a payer, can exchange information with the provider. So if I go to a doctor and they say, oh, we need to do a blood test, if they can see through my insurance company that I recently had a blood test, and they can just get the data from that provider and say, oh, you actually had a blood test at this lab over here. Let's go get that data. So we don't have to give you another blood. We don't have to poke you with another needle.
Right.
So this is all really important in terms of how we share and exchange information. And what's really interesting is what's happening in the United States, which is the Office of the National Coordinator for Health IT, which is basically the sort of governing body for how we deal with things like electronic health records and things like that. They have introduced what's called the Cures Act. Now I get them all confused. But the idea behind this is that patients, there's a few things. Patients have a right to the access to their data. So you as a patient have the right to see and get access to your data for free on whatever device or system that you use. And so the ability for you to then, much like using the Apple Health app, to connect to your health provider and get your data and have access to it is going to now be mandated by law. The providers have to give you access to that data. But also the providers have to share that data to benefit your care. So if you go to a new provider, they need to be able to get your health data from your previous provider to provide you care. And if your previous provider doesn't enable that, that's considered information blocking, and they can be penalized. Because this is all based around, the legislation is based around ensuring that you as a patient get the best care possible. And so the new rule that's being introduced, or that has been introduced by the ONC, is designed to make your data more available to you and more available to the providers that are caring for you. So that's really important because the ONC rule specifies FHIR as the data exchange format. So the healthcare providers must be sharing their data back and forth in the FHIR standard. So everybody will sort of converge on FHIR as the de facto standard for data exchange for health.
Right, so that makes it super important for anyone developing for applications in healthcare to be familiar with FHIR, because that's sort of going to become the de facto standard of data exchange.
Yeah, it's really important if you're currently developing in healthcare, but it's also interesting because I think it creates a new opportunity space. Right? If you're a developer and the fact that data becomes available and it becomes available in a standardized way means you can start to build new systems of engagement, new patient portals and patient applications and ways to get access to my data and do something with it. But you can also start to use that data, provided you have the right to do so. You can use that data in interesting things like machine learning to do some predictive outcomes or some of that. And because the data is in FHIR, you sort of solved one of the early problems in the workflow of machine learning, which is the standardization of the data. So you're wrangling all your data. Normally there's this painful process of like, how do I get it from one type to another? How do I get it standardized? How do I make a patient look like a patient everywhere? FHIR solves that problem by standardizing that data already.
That sounds great, and that sounds like so much more is coming on that path in the coming few years. Okay. So what is Microsoft really doing in this space? What is the Azure API for FHIR that we hear about? Yeah,
so that's sort of the first step in the process. So the group that I'm part of is referred to as Health Next as part of Microsoft. And we've been in the healthcare space for quite some time. In fact, we have some sort of legacy in tools like Health Vault and the Microsoft Band and the services associated with the Band. So we've been in the space and participating. And a few years ago, we sort of saw the writing on the wall, or what we perceived as the writing on the wall, that FHIR was going to become the standard for healthcare data. And we really liked the fact that it, much like I mentioned, sort of things like USB and Bluetooth, it sort of standardized how organizations would work with data and exchange data. So we decided that it was in the best interest of our customers to make it easy for healthcare data to be used in our product portfolio. So if you want to use our cloud for machine learning, or you want to use our tools for analytics, or you want to build new patient portals, things like that, having our product portfolio understand healthcare data in the form of FHIR is really important. And so we went on this mission sort of internally to advocate for FHIR data as a first-class citizen within our product portfolio. The first product we produced that sort of met that expectation was what's called the Azure API for FHIR. And this is simply taking the FHIR specification as it's written and codifying it into a service in Azure. So we don't apply any opinion to the specification. We simply implement it as it's written. So our goal is to be very standardized. And in fact, because FHIR itself is an open standard, we took the approach that we should also build in the open. So we actually wrote the FHIR server as an open source project. And so it's on GitHub, and you can go see everything we've done. The code that we produce and ship through GitHub is the same code that we ship through our Azure service, the Azure API for FHIR. It's the same code. We tend to introduce things in open source first, and then they follow a little bit later in the managed service in Azure. But that was really a response that we got from customers. When we produced the open source project, we said, look, here's a version of the specification that you can run in Azure. Almost immediately, the first question we got from our customers was, great, can you run this for me? Can you do it? I don't want to run it. I want you to run it. And I want you to run it in a way that I can get the benefit of all the compliance work that Microsoft can do on my behalf. And so we responded and said, yeah, sure, we can do that. And so we produced the Azure API for FHIR as a managed implementation of the open source code. So it's the same code, but we run it. We carry the pagers. We have an operations team that keeps it up and running. We do all of the work to meet ISO specifications, to meet HIPAA compliance rules, to get HITRUST certified, to get FedRAMP certified, and we deploy it around the world. So it's available in different Azure regions all around the world.
That's fantastic, because I imagine that HIPAA certifications and, especially when you're dealing with protected health information. And so how do you tackle the compliance and the HIPAA safe harbor guidelines when you're working with this protected health information?
Well, so that's a great question, because there's two parts to that. The first part is, how do we ensure that the Azure API for FHIR can meet the compliance requirements that are defined in the HIPAA privacy rule, and basically ensure that we have all the right protections in place to keep the data safe and secure. And so that's sort of a little bit of our bread and butter, if you will, like the sort of Microsoft table stakes. When we release these services, we release them according to a very strict set of guidelines and how we manage the service, how we run the service, how we encrypt and protect the data. And so we kind of check all of these boxes just along the normal process of building and releasing a service. For this service in particular, we actually had to go a little bit further. Not all of our services at Microsoft are designed for protected health information, but this one is. And this service is only for protected health information. So we had to do a bunch of extra work early to make sure that we were meeting all of the HIPAA requirements, getting our ISO certifications, getting our HITRUST certifications. So that's core. That's a non-negotiable in how we release these services. The second part of the question is really interesting, because the HIPAA privacy rule defines how an entity, an organization, might be able to use data for primary care and for what's referred to as secondary purposes. In other words, if I want to do some analytics on your healthcare data to learn more and maybe get some insight, do some things, but it's not for the direct care of you as a patient. Maybe it's an aggregate with other patients. Maybe it's just learning what to do with you in particular, but not directly associated to your care. That's considered secondary use. And the rules for secondary use dictate that data has to then be de-identified. So if I'm a researcher and I'm doing analytics on your data, I shouldn't know it's you. I can know your conditions, I can know your medical history, I can know your medications, but I can't know that it's you. And so you have to de-identify that data. So we've built into the Azure API for FHIR a de-identification capability. It's flexible, so you can turn the knobs and dials, if you will, to change how you de-identify the data. But we have a standard configuration that meets the HIPAA rules for what's called safe harbor de-identification, which is really sort of redact anything that would be an identifier, your name, your address, your birth date, your phone number, things like that. But we also enable you to turn the dial a little bit. So depending on your data, you can modify that and do what's called expert determination de-identification. In other words, I'm going to change some of this data. I'm going to randomize dates. I need dates in there because I'm doing some machine learning on dates, but I'm going to randomize them. And then I'm going to have an expert in statistics look at the use case, look at the data and say, yes, this is sufficiently de-identified so that the person who's doing the research wouldn't identify the patient. So we can kind of support both of those mechanisms.
Wow, that sounds super interesting. Also, so when you were talking about using the Azure API for FHIR, and then you gave us the example of the data that you're using, say the EMR data from medical records. What about other data that might be created in a hospital system? I'm thinking of like when you go in and you have scans, right? You have your MRIs and CT scans, so imaging data. Is that also part of this process?
So FHIR has a mechanism to support imaging data through what's called an image study. So I can reference imaging data. I can. The thing about FHIR data is it's the clinical data out of my EHR. So I can say, oh, there was an image study done. Here's some information about that image study, and then here's a pointer to where that image study would be in maybe a PAC system or something like that, using the DICOM standards. One of the things that we heard very quickly was that some of the use cases, or many of the use cases from some of our customers, were only achievable if they could understand both the clinical data and the imaging data. I want to find all patients who've been diagnosed with a particular condition, that are on a particular medication, that have had 2 MRI scans in the last 12 months, and I want to see those patients and their scans. You can only do that if you have the clinical data and the imaging data. And so we released into open source back in November what we call the medical imaging server for Azure. And this is similar to the FHIR server. This is a set of APIs and server based on a data standard called DICOM, which is the medical imaging standard. This is a standard that's not new. It's been around for a very long time, and people know it quite well. But again, it's for the exchange and management of medical imaging data. And so we can now take DICOM data. This is an open source project, so you can run it in your Azure subscription alongside the FHIR server. And you can have clinical data in the FHIR server and medical imaging data in the DICOM server. But what's really interesting is to solve some of those scenarios, like the example I gave, you have to get some of the metadata from the DICOM images into the FHIR server. And so we built into our DICOM server something we call DICOM cast. And what DICOM cast does is, as DICOM instances come into the server, we parse out the metadata and we then push that data into the FHIR server. So we create this connection between the medical imaging data in the DICOM server and the clinical data that's in the FHIR server. So now you have a way to query one source, which is the FHIR server, to get all of that information about both, but still be able to reference the DICOM images that are in the DICOM server.
Wow, that sounds really powerful, because what you're saying is then you can look at all of the data right from the medical record to the scans all in one place and kind of look at an entire view of the patient, if you're saying.
Yeah, and part of the approach we took on this was, while these are different data types, different file types, if you will, and different standards for the definition of the data, from a workflow standpoint, you care about both. You generally just care about the image, or generally care about the patient history and the medication history, things like that. You care about both. And so to solve many of the sort of use cases or scenarios that our customers are talking about, they need both of those data sets. So we've tried to design it in a way that enables you to work with just one or just the other, if that's all you care about. If you only care about DICOM data and you're not doing anything that requires FHIR, you can do that. But if you care about both, we've built a way to integrate them in a way that they're sort of loosely coupled, but you can connect them and make that data more meaningful, more powerful.
That's great. One of the other types of data that I was thinking about, especially given COVID in 2020 and how folks have had to stay home but still get care, is remote monitoring. And I think it's becoming so popular, with hospitals having to do virtual visits and having to monitor their patients remotely. And I think that's through the Internet of Medical Things. Does Microsoft support this kind of data coming into the Azure API for FHIR?
The short answer is yes. And this is something that was very early on. Even before we had the problems we now have with COVID, there was a desire in the healthcare space to move to more, you could call it remote monitoring, right? How do I send a patient home but still monitor them and care for them? Because oftentimes it's better for a patient to be at home, better for their health, better for their mental state to be at home and recovering from a surgery or from an outpatient system or whatever. But you still need to monitor them and make sure they're doing okay. And we actually did some collaborations quite a few years ago, where we collaborated on treatment of oncology patients. So enable them to go home so they can heal and be cared for at home, and keep them out of emergency rooms where they're exposed to a number of things that could worsen their condition, but enable the the patients to be connected to their care provider, providing all the necessary data. So we created something called the IoT connector for FHIR. And what this does is enables IoT devices using our Azure IoT platform to collect telemetry data. So you can imagine you have some sort of wearable, maybe on your arm, that collects your blood pressure and your pulse and temperature, and maybe even some mobility data. How much are you moving around? Are you up? Are you down? Things like that. And they can send that data to our Azure IoT platform. And then we, through the IoT connector, can translate that telemetry stream from the raw telemetry coming from the device to FHIR resources. So if you say, okay, once every 15 minutes, we're going to send a snapshot that shows, blood pressure, heart rate, some measure of mobility, temperature, things like that. We can take that data in and turn it into a FHIR observation and then put that in the same FHIR server with the rest of the patient's medical information. And so now the care provider can create, you can imagine like a dashboard where they can pull up that patient. They can see the patient information. They can see their recent procedure history. They can see their medication history, and they can see their real-time data coming from the IoT device. What's the level of mobility? What's their temperature? What's the history of that information? And they can respond to us. Then they can start to look for things like, oh, their temperature is slowly increasing, their mobility is down, we need to intervene. And a lot of times, we found in the particular cases that we were experimenting on, a lot of times the intervention is just a change of medication, like, oh, stop taking this one, start taking that one, or a change in some care plan that keeps the patient healthy, keeps them out of the emergency room, and enables them to continue to be healing. We have talked to lots of customers lately. Now, you mentioned COVID. So with COVID, the push to how do we reduce the burden on our hospitals? How do we reduce the burden on our care units? Patients that could go home, how do we send them home but still care for them? Or in many cases, what we're seeing is, how do I move a patient into maybe a hotel across the street where they can continue to recover, but they don't need all the infrastructure of the hospital. They just need to be close by. We can send nurses to check on them, and we want to have that dashboard to see what their current state is. So that's what the IoT connector is all about.
Great. And I think more and more organizations and hospitals are probably going to start moving to that model, because I can see there's so many different uses of that.
Yeah, even before COVID, we saw data that indicated that was just a growing space, that more and more people wanted to stay connected to their patients when they were outside of the clinical environment, and continue to care for them in a meaningful way.
Right. Which actually brings us to a great question, like, what are sort of the customer challenges that you see that hospitals and other organizations that you're working with face that the Azure API FHIR could help solve for them?
So it's interesting because they're really diverse, and we sort of tend to categorize some of the things we see into different personas. So we see healthcare providers trying to solve things like remote patient monitoring is a great example of areas they're trying to cover, or collecting and managing all of the healthcare information in a way to give that data to the provider to reduce the cognitive burden on the provider, so they can see what's really important at the time. They can ask the right questions. We saw a hospital in the Northeast that was using the Azure API for FHIR to collect data from hundreds of different clinics that were part of their network, pull it into a single place, but then expose it through our Azure search capabilities so that a provider could go in and ask a pretty normal question, like in an English language, and we would convert that question into FHIR queries and then bring that data back to them. So they could say, oh, I need to see the latest procedure done on Lanisha, and then we could turn that into a FHIR query, get that data and expose it. So that was really interesting. We're also seeing health plans or payers that are building systems to look for opportunities to reduce the cost of healthcare, send data back to the providers around where they can change some of the things they're doing. Or even one of the things that has come up is medical insurance fraud is a big thing. So look for indications of fraud and be able to isolate that. And again, all of that drives down the cost of healthcare, which is important. And we're seeing more and more organizations doing research, looking to FHIR as a way to standardize a bunch of data, get it into a system, find cohorts that they might want to invite into a clinical trial and manage those through. So there's lots of different scenarios that people are looking to FHIR and looking to DICOM and saying, if only I could do this, then I could solve my problem. And then as they discover what FHIR and DICOM are capable of doing, particularly together, along with the IoT capabilities, it really sort of opens up what they're able to do. So we're seeing lots of scenarios. It's really fascinating, actually.
And that's probably going to just continue to grow as more and more people start adopting the standard and start, figuring out what are some of the other problems that they may not have even thought of that this can solve, possibly.
Right.
Yeah. So we have time for one more question, and we're getting. I think Microsoft last year announced the Microsoft Cloud for Healthcare, and it's talking about how. I wonder whether Azure API for FHIR is it part of that? How does it support the Cloud for Healthcare? Could you talk a little bit about that?
Yeah, the Microsoft Cloud for Healthcare is what we sort of internally refer to as the industry cloud. But what we really mean by that is, what are all the parts and pieces of technology that we've invested in that we can tailor to and address specific needs in a domain, in this case, healthcare? So the Azure API for FHIR is fantastic, and it solves a great set of problems that somebody might have around how they bring their data to the cloud and use it, but it doesn't solve everything by itself. And so really, you can imagine, well, if I could bring that data from 1,000 different hospitals and clinics into one system, but then if I could connect that to some machine learning or to things like Azure Search to create some better systems, cool. But we have this great platform in Dynamics, and we have this great platform in M365 with things like Teams for coordinated care or for remote patient care. How do we integrate that data into these tools? How do we create templates for common scenarios that a healthcare provider or payer can say, oh yeah, we have that same problem. Give us a head start. Let me take that template. You have a patient engagement template. Great. I need that. Let me use that as the starting point. Let me tailor it to my specific needs. And then I've got a solution that meets my needs. And it really is the combination of all of that coming together. I need this data in Azure because I need to do these other things with it, but I also need to expose that data in tools like Dynamics to build those front-end applications that I'm going to use either internally or externally.
That sounds great. So I think that's about all the questions we had for you today, but thank you so much for taking the time to talk with us and explain to us about FHIR, the Azure API for FHIR, and all the great things that I think the healthcare industry is going to be able to do with the open standard of FHIR. So for more information, everyone can visit docs.microsoft.com. It's on the banner below, and you can learn more about the Azure API for FHIR. But thank you, Doug. Thank you for joining us, and for everyone online, please join us for the next session of Ask the Expert. Thank you.
Thank you, Lanisha.